Dr. Lewis, can I staff a patient with you?
Oh, hey, Zara. Sure. Come on in.
Okay.
Yeah, just close the door.
Okay. So
Actually, you know what? Open the door. It gets a little stuffy in here.
okay.
Great.
Okay. So the patient is a.
I'm sorry. We ought to close it. HIPAA violations.
Okay. Yeah.
Leave it open a crack.
Oh, okay.
Yeah.
Okay. So
Let's just close it all the way.
close it. Yes. Okay.
Great.
So the patient is a 65-year-old male, born by normal spontaneous.
I'm sorry. I just got a text. I just need to respond to this.
Oh, okay.
It's from the World Federation of Neurology.
Oh, of course.
Yada yada yada. Blah, blah. I'm just going to respond. Speech to text. Okay. Sounds good. Period. Send. Okay, great. Sorry about that. Go ahead.
Oh, of course. So this is a 65-year-old male born by normal spontaneous vaginal delivery. To be thorough, APGARs of 8 and 9 at 1 and 5 minutes, respectively. He had normal motor, language, and social development. He has a past medical history of dehydration headaches during college, which is now resolved. Also, some sleep difficulties when his children were in infancy, now resolved. Periodic razor burn. He's developed hypertriglyceridemia in his 40s and hypertension in his 50s. He had an episode of onychomycosis at the age of 54, treated with terbinafine, now resolved. And his pertinent negatives include Whipple's disease, MS, stroke, spinocerebellar ataxia, and he's presenting to clinic.
I'm sorry, I was not paying attention. Could you repeat that?
So he's presenting to clinic with post-traumatic numbness and tingling of the 5th digit of the left foot. So these symptoms began with sudden onset 3 days ago as he was walking towards the refrigerator and he struck the left foot against the coffee table, most prominently at the 5th digit. Thereafter, he experienced an immediate nociceptive response over the digit of question, and that was followed by numbness and paresthesia over the area. So this has been gradually resolving since onset. My differential includes a stroke in the ACA territory, most specifically of the precentral gyral A3 division, versus seizure secondary to autoimmune encephalitis. Just to name some of the common antibodies that we all know now, it could be anti-MOD2, anti-GABA-A, LGI1, LMNOP, QRS, TUV, WR, X, Y, and Z, just to name a few.
These antibodies, they're all just so kind of flavor of the month. I never know what to think about them, but what do you know about them?
Well, Dr. Lewis, don't you know, I updated the website with all the up-to-date information about all these antibodies.
Oh, right. I did read your website. I'll schedule a time to read it again.
Okay.
Note to self, read Zara's website, exclamation point. Okay, go ahead. What do you think we should do with this gentleman?
So I think that we should give him a load of phenytoin and hook him up to continuous EEG, of course. And then we'll have to put MRI compatible leads, because I also think we need to do an MRA of the brain with and without contrast. And then we'll need to get an LP and send the Mayo encephalopathy panel as well. And then if all of that's normal, I think we need to consider doing a nerve conduction study and target the abductor digiti minimi of the left foot.
I agree with your plan. I might also send an MRI of that foot. We're getting the MRIs. I think it could help us with the yield.
I think it's a great plan then. Okay, yeah, definitely.
Okay, let's go see him.
Okay, thanks, Dr. Lewis. Hi, Dr. Lewis. Can I staff a patient with you?
Oh, sure, Zara. Just one sec. Just hold on.
Dr. Lewis, please. I have a patient I need to staff.
Okay. Oh, come right in. Yeah.
Okay. So Oh my goodness, I have had a headache all day. Can I shut the lights
Sarah,
off?
Sure,
Can I shut the lights off?
go ahead.
Okay.
Sure.
Okay.
Do you want an now and later? It might help.
No. Oh, chocolate. Chocolate's
Oh,
good.
okay.
Oh,
You know what? I just got a text. I just have to respond to this, but just one sec.
No, Dr. Lewis, no. So this patient, I just can't even believe this. He's here with left foot numbness. Can you believe that? He comes to my clinic with left foot numbness. I mean, this friggin' toe pain is it. So I think he just needs to go. He can't come to our clinic for this, right?
Okay, ready to staff. Zara?
Hey, Dr. Topel, how's it going?
Okay, Ben, pretty good. How you doing?
Good. I went to Appleton, back home this weekend. Took the family, had a good time. Have you been to Appleton?
Never have been there.
Okay. It's near Green Bay where the Packers play.
You know, my Packers big smoke.
Oh, sorry. Can I get you one of these?
No, thank you.
Okay. Do you want to know what it is?
What is it?
It's a White Russian. They're really good.
Very good.
Yeah, but anyway, it was so fun in Appleton. We took the family camping, and we ate a lot of Apple Jacks. They're really good, and yeah, it was just a good time overall.
That sounds very exciting.
Yeah. Anyway, you want to hear about my patient?
Sure.
So, this is Miss Smith. She's a history of atherosclerosis and following her for migraines for many years. She's been taking her triptan and she's been pretty good. Nothing new to report.
It's good. Glad to hear that.
Yep. Oh my God! Help! Help! What's going on in there?
I'm in labor. I need somebody. I need a doctor. Help.
Oh yeah, sure, I got it.
Okay, that's
Are you
great.
about to?
Yeah. Oh my God.
Oh, okay.
Please, help.
All right, get ready.
Oh God. Ah! No!
I got it. Hey ma'am, here's your baby.
Wow, Dr. Savage, you are the best OB-GYN I've ever met.
12 pounds. Healthy young man.
Wow, thank you so much.
Sure, anytime. Oh, hey, ma'am.
Hey,
How's it going?
good. How are you?
Pretty good. Can I run this email by you?
Sure.
Well, here it goes. I'm trying to put together like a resident social outing event. So it kind of goes like this. Hey guys, I know I haven't been like the best at rounding us up this year for fun events, but now that we're 11 months into the academic year, I wanted to put together an incoming Neuro junior welcoming event. It would be nice if we could get to know each other a little bit. I'll send this email out to them too. Oh, and if you see them around Rush, make sure to promote the event. Their names are Catherine Daly, Gregory Fenton, Rachel Foreman, Teresa Lee, Stephanie London, Jacob Mans, Timmy Smith, Kajina, Zena Warrior Princess, Kathy Sloda.
Whoa, Ruby. I thought you meant you were going to send an email to the incoming juniors, not the current juniors.
Oh yeah, dude. No, dude. Man, dude. I totally mean the welcoming party for the incoming juniors would be the upcoming social care responsibility, right? I just thought it would be fun if we could get to know the current juniors a little bit. Anyway, dude. Hear me out, okay? Hear me out. One sec. Hey. Oh, hey, Spencer. How's it going? What? What do you mean we can't have the elephant for the wedding? A white stallion? No, that is not gonna work. Take care of it. Alright, love you. Bye. Anyway, getting back to the email. So here it goes. Let me know what you guys would maybe, possibly, kind of, sort of want to do. I was thinking along the lines of picking up some food, maybe some Taco Bell, and eating it on the benches outside the POV one day during conference. Either that or something else that's fun. So anyway, everyone reply back to me one date that will work for you within the next 6 months, and we'll plan to schedule it for whenever we're all free at the same time. Fondly, Ruby. Dude, great. I'm like super pumped for this.
I'm excited too. I'll see you there.
Oh, dude. Yeah, actually, I have a bridal shower that day.
Your bridal shower?
No, not my bridal shower, my friend's.
Oh.
But I mean, we could totally get some like Taco Bell right now.
Ruby, it's like 8 a.m. But do they have triple shot espresso?
Dude, totally. Let's go.
Okay.
Hey, Dr. Topel.
Oh, hey, Colin. What do you got for me?
Got this patient. Super fascinating. Really fascinating patient. So, here's the deal. 46-year-old male, past history of diabetes, hypertension. Real nice guy. Super fascinating. Been having symptoms for a few years, on and off, but super nice. We got to talk about a lot of stuff. He's really into woodworking, so we got to talk a lot about the woodworking. He actually has a plan of opening a shop with his family. And then we got talking about some of his other hobbies. He's really into gardening too, which I think is pretty cool. Anyway, really nice guy, super fascinating. Let me see. So basically, this guy's coming in with like tremor and like weird like other movements. So basically, like starting at the beginning, like he basically does this thing where he like his lower mouth kind of like keeps ticking down like this, but then the upper one's like going like that, and so it's like this combination of like down and up, and then it's like this sometimes, and then his arms, like he's got this kind of like a 3 to 5 hertz tremor in this hand, and then meanwhile this hand's going at like 7 to like 8 hertz, and then it's like spasmus, and then kind of like more like ptosis on this side, and then his gait, you should see his gait. It's more like this almost. It's like kind of like this dystonic thing, but then when he walks backwards, it's actually more like Parkinsonian for some reason. And then he actually does like kind of like a moonwalk sometimes, and. And so I think it might have some kind of oral-mandibular dystonia from anthocyanin kinase-associated neurodegeneration. So we were just talking about that, and basically, I think we should try him on a trial of dopamine agonists. See how he does. We can call him back in like a week or two. See how he responds to that. We can also titrate at that point. We can figure out what else to do. Maybe some PT, some OT. And if that doesn't work, we can always send him to movement disorders. What do you think? I mean, I think it's super.
Oh man, my speakers aren't working. Unan! What's wrong with my phone? Hanan!
My Epic just shut down. Hanan! Where is he? Hey Hanan, my Epic's not working in there. Could you help me with something?
Whoa. I'm mining gold on there right now.
Can I use the computer though?
You can't use that one because I'm doing League of Legends there. And actually, you can't use those either because I'm doing World of Warcraft and Age of Empires down there.
But how are you playing? You're on your phone right now.
Yeah, I'm changing my baby's diaper.
Okay, I guess I'll just go use Jacob's computer.
Oh, I beat level 9 right now. I'm going to go staff with Dr. Topel. Hi, Dr. Topel. I have a patient I would need to staff with you. So she's a 64-year-old female. She's got sensory problems, balance problems, coordination problems. I already placed the A line in her. She'll need an EVD, but we can do that later. We need to keep her systolic blood pressure less than 160. Have to run fast times, but I'd like to show you some exam findings first. Wait! Don't move. There's a Pikachu on your head. Got him. Okay, Dr. Topel, here's the sensory exam.
Ah! Ah! Ow! What the hell? Ah! Jesus!
And feels generally the same on both sides?
I don't know. Can we try that again?
Let's move on to the coordination exam. Can you take your finger and touch my finger? Good. And touch your nose. And take your heel and run it up and down the front of your shin. And can you do this?
No, I can't do that.
Okay. Stand there with your heels together and close your eyes. Positive, Romberg.
This is Dave with neurology. I was paged. So, right-sided weakness and aphasia. It started 30 minutes ago. Alright, I'll be right there.
That sounds fascinating. You should probably go. Come on in, Dave.
Hey, Dr. Topel.
I have a patient to staff with you. So we have a 30-something-year-old male who comes in complaining of bradykinesia. He first noticed this when building his Lego blocks. He reports that he had loss of dexterity with stacking the top brick. His coworkers also note an increasingly monotone voice. These problems have been developing over the past 3 to 4 years. So he doesn't have any significant past medical history, no medication, no surgeries. On exam, we have a moderately handsome young man with a Jimmy Neutron-like sweep of his hair. He appears younger than his stated age, but has masked facies, bradykinesia, but no rigidity or tremor, though he does report an inner tremulousness that wants to come out. In addition,
Fascinating. Hey, fascinating. Utterly fascinating.
I agree. In addition, he has a slow, shuffling gait with decreased arm swing. So that's the story. Overall assessment of this moderately handsome young man. What are your thoughts, Dr. Chakala?
Sounds like you got this one, Dave.
Well, some people might think it's Parkinson's disease or Parkinsonism, but I think this young man is just ready to sleep. What's up, Dr. T?
Oh, hey, Brian. What's going on? You look a little different.
Yes. Probably just a helmet.
No, there's still something a little bit off. Oh, I see. You look good.
Thanks.
So, you excited about Utah?
Yeah, it's getting pretty rad. Dope out there. The program's pretty chill. I don't really have to take call or do anything. There's nothing chill outside all day. Pretty chill.
Oh, yeah? Where are you going to live?
I'm just gonna put in a tent.
Well, I will not be visiting you. Alright, well, what do you got for me today?
Oh, I got this pretty rad patient. He's a brewer, owns his own local brewing company. He's got pretty nice IPA. We're just gonna, we're talking, and I think we're gonna go to this Wilson Street Garden Festival this weekend. Actually, this brewery is gonna be featured there. It's pretty cool. So, I don't know, this guy, he used to live with me. We met at a shelter a couple of years ago. Pretty dope there. He moved out, but he's got a cat now. This cat likes to hang out with my cat, Young, or as I like to call him, Young. But yeah, I just fit him in for term extended today.
Why is he here? What's he presenting with?
Oh, we just hadn't gotten to chill in a while, so we needed that 90-minute, 90-second chill set.
Fascinating.
Yeah, he's pretty
Well, what do you want to do with them?
Oh, you want to just, like, hit that dojo?
All right.
All right.
Let's go see him.
Let's go.
Hi, Dr. Zahn. I just wanted to tell you about a stroke code that I saw in the emergency department. So the patient's a 45-year-old female with past medical history of lupus and antiphospholipid syndrome who just came in with a full left MCA syndrome about 30 minutes ago. So she already got TPA, and actually DLO was taking too long, so I just did the thrombectomy myself. So she's actually already ready to be discharged from the emergency department, and I actually already hired a cleaning lady for her at home. Okay, thanks. Oh, hey, Kyle. No, you don't need to do anything. I'll come home and take Gray for a walk. Also, there's jerk chicken and strawberry cheesecake in the fridge that needs to be eaten before they go bad. I made them this morning at 5 in the morning. Bye. See you later. Hey, Dr. Japonis. I want to tell you about a MICU console I just saw. Oh, wait, actually, I just made some cookies. I'll be right back. Sorry about that. But anyway, the man's a 100-year-old male with past medical history of dementia. So we're getting a consult for altered mental status. So actually he has sepsis, he just had acute renal failure, and his sodium's like 120, his ammonia level is 500. He's getting fentanyl boluses. So I already gave him Vanc, Zosyn, I bolused him with fluids, and I just hooked him up to dialysis myself because it was taking too long. And then I also just dry cleaned his slacks. Okay, sounds good, thanks. Hi, this is neurology. I just got a page from the emergency department. Mm-hmm. So you're telling me the nurse just known had dysarthria, but is here for acute appendicitis, and just had part of his tongue resected for squamous cell carcinoma? Yeah, I'll make sure to see him right away so you don't get dinged.
Hey, Chuck, aren't you supposed to be on vacation?
Yeah, why do you ask?
No reason. Forget it.
Oh God, the computer is not working again. Hold on. Hey, it's been like 5 minutes since I showed you a picture of Ray. This was her first spook.
Bye, guys. It has been great having you here. You will be missed. You are loved. And I just pray the future is brighter than this smile you see. Smooches love you.
Co-workers also reported that I don't know what I'm saying.
It's okay.
Hi, guys. This is really an emotional moment for me. You guys were here when I got here, so it's bittersweet. I just want you guys to know it's been great. You guys will be greatly missed. And I wish you didn't have to leave me. It's so sad to see you go. Love you guys, and I know you'll be great as you already are.
And on that note, make sure you guys do your travel authorization forms. I'm just kidding. But wish you the best of luck and congratulations on graduating. And you guys made it so proud of you guys.
Congratulations, you guys. Wish you the best of luck.
Hi, seniors. It's Janine. And I just wrote a little something for everybody because I didn't want anybody to feel left out. Dr. Whitney, it took a while to get to know you because you're very quiet, studious, and you have an excellent poker face. But you are a good doctor and the patients love you, and they'll miss you, and I'll miss you too. To my Ruby, I'll miss seeing your smiling face, but I am proud of you, and your patients always have nice things to say about you. You will do well in your new position, I have no doubt about it. Dr. Chuck, you are so smart, and your interaction with your patients is outstanding. Your patients love you, and so do I. And I love your cookies. You wait till Christmas time. Dr. Hussein, I have seen you literally come out of your shell. You are a very brilliant young lady, and the care and concern that you show makes your patients know that you really care. You will be missed. Dr. Marcus, you have a way of making the patients laugh and smile, and you are a very intelligent doctor. And I like your haircut. Dr. Chandra, you're a very quiet, serious guy, but a good doctor who doesn't beat around the bush. You're all business, but I've seen your funny side too. We're gonna miss you around here. Dr. Savage, you are a wonderful doctor. You're an easygoing guy, great with the patients, and you get the vote for the best hair and beard in the department. And last but not least, Dr. McLeod, I'm gonna miss you coming out with your last patient at 5:15 when it's time for me to go home for me to check them out. But you're a great doctor with a good bedside manner, and your patients will miss you much, but not more than me. Love you guys. Best wishes.
Oh, hey, man.
All of my graduating residents, I am so happy I got to know you over these past couple of years. You guys have all been so amazing. I wish you the best of luck. I'm going to miss you terribly, but I know you guys are going to go on to do great things in the world of neurology. And as always, even if I'm not your residency coordinator, I'm always here to help. So, best of luck to you all. I'm going to miss you guys so much.
Hi everyone, I just want to wish you guys all congratulations for the 4 years that you've done in residency. I appreciate everything that you've done to help me with the medical students, all the evaluations you completed, the LP simulations, and all of the teaching sessions and lectures you guys have done. All the students I know have really appreciated it, as have I. I'll miss everybody, and good luck, and you know where to find me.
That's perfect.
It's a solemn moment, and it's a very sad moment. You've been working really hard. I'm very proud of you. I love you all. The last words, take care of yourself. Take care of your families. Take care of your patients.
Hey guys, it's been a great 3 years. Really happy for you. Congratulations on graduating, and stay in touch.
Pretty much it.
Could you sit up a little bit more, please?
Oh. Do you want one of these, by the way?
Yeah. And can you do this? I can.
Graduates, this has been an amazing last couple of years working with all of you. I love you all, and I'm just especially lucky that half of you are sticking around for the next year, and hopefully even longer for some. That would be wonderful. To the rest of you who are moving on, good luck, and we'll miss you so much.
So, thereafter.
Hi, graduating Armed Force /Chief class. Congratulations, you guys have worked really hard. It's been wonderful working with you these last few years. We're all going to miss you, and we know you're going to go out and do wonderful things. I'm going to miss all of you guys, especially after I leave Rush. But you guys were the first class that I worked with as an attendee, so of course you're very special to me. And please keep in touch and let me know how things are going. And say hi if you're ever in San Francisco.
I want to wish all the graduating residents the absolute best of luck. You're all terrific, talented, wonderful doctors, and I'm really privileged to be able to participate in all 3 years of your training. As you know, I'm available at any time by text, and you can ask me anytime for a letter, really for the rest of your career, because you're all terrific.